This is a major difference in doctor conviction between a weak and strong doctor, between a doctor who has low prepay rates and low patient retention, and a doctor that has high prepay rates and high retention. This is one of the main reasons right here. The doctor who does not know and do what I'm getting ready to share with you right now almost always has low prepay rates, lower patient retention. The doctor who does what I'm getting ready to show you always has higher prepay and higher, in other words, usually have a pretty good patient retention. And here's the difference why. When you look at all the biomarkers, okay, now I'm talking about conviction, because remember, the single most important component of patient retention is conviction. How much you believe and know what you're doing. That's on the science of the three phases of healing. That's what I was just explaining. I mean, how well did I know the basics of physiology? Pretty straightforward. So it's real easy for the doctor to understand symptoms because they were raised on it themselves. So that's not an issue. It's pretty easy for them to understand tenderness as a biomarker. It's pretty easy for them to understand reflexes and dermatomes, but those typically aren't positive. And it's pretty easy for them to understand the orthopedic test should be normal. Usually they don't do them right. They don't position the patient in the overpressure. When they do it, they get false negatives. And the patient goes back to active range of motion. That's typically the limited mindset of the doctor who has low information in the science of the three phases healing. And that's the recommendations they get. That's what the treatment's based on. In other words, everything's low, low, low. Because what do they not pay attention to? They don't pay attention to the overpressure. They don't pay attention to the bones moving. Because they don't have the belief in it. They don't know it. They don't have the belief in it. They don't have the conviction in it. And that makes the major difference when you talk about the bones moving and the strengthening of the tissue and the mobility. That's the difference. Understanding and believing how that works. That's the difference of the doctor who has higher conviction and has a higher patient retention, higher prepay rate versus the doctor that doesn't. The doctor that understands those biomarkers versus the doctor who's only going on symptoms and active range of motion and a few orthopedic tests. That's the difference between a high and low patient retention doctor right there. That's the number one difference right there. That's the gap you got to get over. That's what you have to learn. And most doctors never even looked at intersegmental motion before they joined me. They didn't even measure it. They didn't even do overpressure. They didn't even do palpation, fixation, joint motion. They didn't do any of it. So they don't even know about it. So guess where the conviction level is? It's not even there. It's not even there. And until you learn that, you'll always have low patient retention. You won't be able to sell these other biomarkers. You don't even know them. You don't even believe in them. I just told you the number one real reason with patient retention right there. I see it all the time. Because we make money affordable. We take money way down. When we go to biweekly payments, we take that way down. Usually we don't make money an issue. And then some doctors have an issue with time, getting the patients coming in 3 times a week. That definitely is an issue. So there's different issues, with patient retention. But what I just told you is the number one factor right there. Soon as that doctor understands not just pain, inflammation, orthopedic test, range of motion, overpressure, joint motion, and the therapeutics for all of them, and 3 phases healing, and increasing not only the joint motion and active passive and joint motion, range of motion, but also the strength and elasticity. And the joint motion is measured by the motion studies at the re-exams, and you won't see physical changes on an x-ray in less than 90 days with physical medicine. So they typically are at least being seen 3 times a week, maybe up to the first re-exam, and then twice a week until the 3-month period. Most doctors don't do that if they don't have a belief in it. They're not paying attention to the motor units on the motion x-ray, the strengthening and the elasticity and the repair phase. They almost will always have low patient prepay rates and retention rates. Take that for what it's worth. Where are you at? You got to think to yourself, where are you at? Do you understand motor units? Do you understand the dynamics of the importance of motor units, the relativeness of motor? How does this relate? And I'd say that to the patient. So does that look normal to you? After I explain normal, does that look normal to you? No. Then I'd say, if it stays like that, do you think the problem's going to stay away, or do you think it's eventually going to come back? It's going to come back. That's what I said to the patient that had all the normal tests. They had all the normal tests. I just kept them on their treatment schedule twice a week up until the first motion study. And then I'd show them that. See, because I wasn't paying attention to one test. I was paying attention to all of them, but specifically I was paying attention to the single most important test. Because if I find this x-ray on the first re-exam motion study, I already know what's going to happen to that pain again. What's going to happen to the pain, muscle spasms, restrictions, fixation? It's all coming back. And I get the patient to see it and say it. And that's what I base my care on. Not that they're not having any symptoms. Symptoms are going to come right back. Doesn't matter if they're totally pain-free. You have this abnormal spinal motion, it's coming back.